Why the carnivore diet can resolve vitamin D deficiency without extra vitamin D. People who switch to the carnivore diet start reporting some pretty remarkable things. Autoimmune conditions they've struggled with for years begin to fade. Persistent depression lifts. Chronic joint pain dissolves. Some even notice their relationship with sunlight changes. They tan more easily, burn less frequently. And here's what's striking about all of that. Every single one of those conditions has a strong, well-documented connection to vitamin D deficiency. So that should make the carnivore diet a goldmine for vitamin D, right? Not exactly. And this is where things get genuinely interesting. Beef, chicken, pork, the staples of a carnivore plate, contain surprisingly modest amounts of vitamin D. On a typical carnivore diet, you're probably taking in somewhere between 500 and 1500 IUs of vitamin D3 per day. That's slightly better than what the average person gets from a standard Western diet, sure, but it's nowhere near the massive dose you'd expect to reverse a serious deficiency. So, what's actually going on here? How is the carnivore diet resolving vitamin D problems when it isn't supplying much vitamin D at all? To understand the answer, we first need to challenge the way most people think about vitamin D deficiency in the first place. The mistake most people make. The conventional response to low vitamin D is simple: take more vitamin D. People buy supplements, they increase their doses, they get retested, and then they're baffled when the numbers barely move, or their symptoms persist even when their blood levels look normal on paper. This happens because vitamin D doesn't function in isolation. It's not a standalone nutrient you can just top up like filling a gas tank. Vitamin D is deeply dependent on a network of cofactors, supporting nutrients that determine whether vitamin D actually gets absorbed, activated, and put to use inside your cells. Strip away those cofactors, and you can flood your bloodstream with vitamin D and still end up functionally deficient. The vitamin is there, it just can't do its job. Let's walk through the key players, the cofactors that make vitamin D actually work. Magnesium is probably the most critical. It's involved in the enzymatic conversion of vitamin D into its active form. Without adequate magnesium, vitamin D essentially stays in a dormant state. Now, here's something most people don't realize. Meat provides magnesium in a highly bioavailable form, meaning your body can actually absorb and use it efficiently. Plant-based magnesium? It's a different story. Plants contain compounds called phytic acid, oxalates, and lectins, anti-nutrients that bind to magnesium and other minerals and physically block their absorption. Grains are particularly loaded with these. So even if you're eating magnesium-rich plant foods, you may not be absorbing nearly as much as you think. Vitamin K2 is another major piece of the puzzle. Think of vitamin D and K2 as business partners. They work as a team. Vitamin D is responsible for pulling calcium into your bloodstream. But without K2, that calcium doesn't know where to go. It can end up depositing in arteries and soft tissues rather than where you actually want it, in your bones and teeth. K2 is the signal that directs calcium to the right destinations. And K2 is found almost exclusively in animal-based foods: fermented dairy, egg yolks, organ meats. Zinc plays a different but equally important role. Vitamin D doesn't work by floating around in your blood. It has to enter your cells through a specialized doorway called the vitamin D receptor. Zinc is essential for that receptor to function properly. If you're deficient in zinc, those receptors don't respond the way they should, and even if you have reasonable vitamin D levels, the cellular uptake fails. Animal protein is one of the richest dietary sources of bioavailable zinc available to us. Retinol, the active form of vitamin A, is something a lot of people overlook entirely. Vitamin D and retinol share a synergistic relationship at the receptor level. They work together to activate gene expression. The critical word here is retinol, not beta-carotene, which is the plant precursor to vitamin A that many people assume is equivalent. Retinol is the real deal, the form your body can actually use directly, and it's found in egg yolks, beef liver, and other animal products. Plant foods don't contain retinol. Cholesterol rounds out the list, and its role is foundational in the most literal sense. Vitamin D is actually synthesized from cholesterol. When sunlight hits your skin, it triggers a conversion process. But the raw material for that process is cholesterol sitting in your skin cells. If you're not consuming enough cholesterol, you may simply not have enough of the building blocks your body needs to manufacture vitamin D through sun exposure. This is one reason why extremely low-fat diets can quietly undermine your vitamin D status over time, even in people who spend plenty of time outdoors. When you look at the carnivore diet through this lens, something becomes clear. It's not delivering a megadose of vitamin D. What it's doing is systematically supplying every single one of these cofactors in their most bioavailable, easily absorbed forms, while simultaneously eliminating the plant-based anti-nutrients that block them. The vitamin D receptor problem nobody talks about. Here's a layer to this that goes even deeper, and it's one of the most underappreciated drivers of functional vitamin D deficiency: vitamin D receptor resistance. Your cells have vitamin D receptors, specialized proteins that vitamin D must bind to in order to exert its effects. When these receptors become resistant or downregulated, vitamin D can't get in. It doesn't matter how much is circulating in your blood. The door is effectively locked. Vitamin D receptor resistance is far more common than most people, including many physicians, realize. And it creates an insidious situation where someone's blood test looks acceptable, but their tissues are starving for the vitamin D that can't get through. What causes receptor resistance? Inflammation is the primary culprit. Chronic, systemic inflammation, particularly gut inflammation, physically interferes with the receptor's ability to function. And here's where the carnivore diet becomes particularly powerful. Of all the changes people report when they go carnivore, the most consistent and dramatic is a reduction in inflammation, especially gastrointestinal inflammation. By eliminating grains, legumes, seed oils, processed sugars, and plant compounds that trigger immune reactivity in sensitive individuals, the carnivore diet removes many of the most common sources of gut inflammation simultaneously. That reduction in inflammation helps restore receptor sensitivity, allowing vitamin D to finally enter cells it was being blocked from. Infections also play a role here that often goes unacknowledged. Certain viruses, Epstein-Barr virus and Borrelia, the bacterium behind Lyme disease, among them, have been shown to strategically downregulate vitamin D receptors. This is thought to be a mechanism by which pathogens weaken the host's immune defenses. If you've had a history of chronic viral illness or a tick-borne infection, your vitamin D receptor function may have been compromised for years without anyone making that connection. This is part of why some people with autoimmune disease, depression, or chronic fatigue see remarkable improvements on a carnivore diet, even without dramatically increasing their vitamin D intake. The inflammation drops, the receptors open back up, and suddenly the vitamin D that was already in their system can actually reach its targets. The gut, the most underestimated factor. If there's one thing I believe the carnivore diet does better than almost any other dietary intervention, it's healing the gut. And the gut's role in vitamin D absorption is enormous, probably more significant than most people appreciate. When the intestinal lining is inflamed, damaged, or compromised, nutrient absorption across the board takes a hit. Vitamin D is a fat-soluble vitamin, which means it requires healthy bile production and a functional gut to be properly absorbed. An inflamed gut is a leaky, underperforming gut. It simply can't absorb nutrients the way a healthy one does. Carnivore helps on multiple fronts here. First, by removing common irritants, gluten, lectin-rich legumes, high FODMAP foods, inflammatory seed oils. It stops adding fuel to the fire. Second, animal proteins are rich in specific amino acids, like glutamine and glycine, that are directly involved in rebuilding and maintaining the integrity of the intestinal lining. You're not just reducing damage, you're actively supplying the repair materials. There's also the role of bile. Healthy bile flow is essential for absorbing fat-soluble vitamins, including vitamin D. Improving gut health supports better bile salt production and function. And then there's SIBO, small intestinal bacterial overgrowth. This condition, where bacteria that should be confined to the large intestine proliferate in the small intestine, directly impairs nutrient absorption, including vitamin D. Bile has natural antimicrobial properties that help keep microbial populations in check in the upper GI tract. As gut health improves, SIBO burden tends to decrease. Candida overgrowth is another frequently overlooked disruptor. Candida thrives on refined carbohydrates and sugar. On a carnivore diet, you're cutting off its food supply completely. Without glucose to feed on, Candida populations are starved into decline. This matters because Candida overgrowth can contribute to gut permeability and systemic inflammation, both of which suppress vitamin D function. Insulin resistance and obesity, the forgotten blockers. Two more barriers to vitamin D that the carnivore diet directly addresses: insulin resistance and excess body fat. The relationship between obesity and vitamin D deficiency is well established. Vitamin D is fat soluble, and in people with excess adipose tissue, a significant portion of circulating vitamin D gets sequestered in fat cells rather than being available for use by the rest of the body. This is one reason why people with higher body fat percentages tend to test lower for vitamin D even when their sun exposure and dietary intake are adequate. Insulin resistance compounds the problem. High insulin levels and poor insulin sensitivity are associated with reduced vitamin D uptake at the cellular level. The carnivore diet is one of the most effective dietary approaches for rapidly improving insulin sensitivity. Carbohydrate intake drops dramatically, insulin secretion decreases, and cells begin responding to insulin more efficiently. As insulin sensitivity improves, vitamin D absorption improves along with it. Autophagy, the cleanup crew. There's one more mechanism worth discussing, and it connects the carnivore diet's effects on vitamin D to something much broader. Most people eating carnivore naturally shift into a metabolic state that promotes ketosis, and with it, elevated autophagy. Autophagy is the body's built-in cellular cleaning process. It breaks down and recycles damaged cellular components, clears out dysfunctional proteins, and critically helps eliminate intracellular pathogens. Remember the connection between past infections like Epstein-Barr virus and vitamin D receptor downregulation? Autophagy is one of the mechanisms by which the body can clear residual viral material and help restore normal cellular receptor function over time. It's not a guaranteed fix, but it's a meaningful part of why people with long-standing chronic illness sometimes see improvements they didn't expect from dietary change alone. The combination of reduced inflammation, restored insulin sensitivity, improved gut absorption, autophagy upregulation, and full-spectrum cofactor delivery creates a systemic environment where vitamin D can finally do what it's supposed to do, even at intake levels that wouldn't normally seem sufficient. Putting it all together, the carnivore diet doesn't fix vitamin D deficiency by flooding you with vitamin D. It fixes the conditions that were preventing your vitamin D from working in the first place. It delivers magnesium, zinc, retinol, K2, and cholesterol in their most bioavailable anti-nutrient-free forms. It reduces the gut inflammation that blocks receptor function and impairs absorption. It improves insulin sensitivity, which directly improves cellular vitamin D uptake. It starves pathogenic microbes that were contributing to systemic inflammation. It promotes autophagy, which helps clear the lingering remnants of past infections that may have been down-regulating vitamin D receptors for years. None of these mechanisms require an enormous vitamin D intake. What they require is an internal environment where vitamin D, however much is present, can actually be used. Think of it this way. If your environment is compromised, everything inside it struggles regardless of how well you feed it. Clean up the environment, and the same inputs suddenly produce dramatically different outcomes. That's what the carnivore diet appears to be doing for the people whose vitamin D-related conditions are resolving without high-dose supplementation. This isn't a blanket argument that everyone should adopt a strict carnivore diet. Individual responses vary, and there are multiple paths to improving metabolic health. But understanding why carnivore produces these effects gives us a much more sophisticated picture of how vitamin D actually works in the body. It's not simply about how much you consume. It's about whether the entire system supporting vitamin D absorption, conversion, receptor sensitivity, and cellular uptake is functioning the way it's meant to. And if that system is broken, which for a significant portion of the population it quietly is, taking more vitamin D without addressing the underlying dysfunction is a bit like pouring water into a cracked container and wondering why it stays empty. Fix the system, and the nutrient can finally do its job. If you found this breakdown valuable, there's even more to learn about vitamin D, including some findings that are genuinely surprising. Check out the next video for a deeper dive into what makes this nutrient so much more complex and fascinating than most people realize.